Every time I menstruated, I would be incapacitated in total agony for days. After numerous visits to my GP, I was prescribed the combined oral contraceptive pill at the age of 13 and told that what I was experiencing was a normal part of being a woman and that I was just unlucky. One of the things I've struggled with is that people mistakenly believe that because you have had surgery, you should be fine now. I still have a lot of pain. Also, putting on a brave face can be hard. It's 7 steps from my bedroom to my bathroom. I know this because I've counted them, because on a regular basis I steel myself to make the walk. Infertility makes you question whether you are worthy of parenthood and happiness. It's always present. New pregnancy announcements, christenings, visiting nieces and nephews. It's always us that leaves empty-handed with a lonely heart. Namaskar, hello, thank you for joining me as today I introduce a new playlist in my channel on a theme that is closer to home. I am an obstetrician and gynecologist by profession. Today is International Women's Day and finally I will be using this platform to talk about women's health. In my professional community, every year the month of March is considered as the month of endometriosis awareness, and the topic for us for this week is this very debilitating condition that affects 168 million women globally. That's roughly the same number of women who suffer from diabetes. But don't worry, this is not going to be a prolonged discourse, and I promise not to throw medical jargon at you. Think of me as your gynecologist friend. You are sitting here with me in my cozy living room and we are having a heart-to-heart rather than ovary-to-ovary chat on endometriosis. So endometriosis affects women of reproductive age, that is from the beginning of one's menstrual life to menopause. It is a long-term condition that can have devastating consequences on a woman's physical and mental health. Studies, work, relationships, fertility, basic daily routines can be affected. In my medical practice, I have seen endometriosis engulf not just the affected individual, but everyone close to her. Imagine being in debilitating pain, yet not being able to speak out because hardly anyone will understand. Because you have constantly been told to grin and bear. Because this is a lady problem and you have been taught to keep it private. This video is not just for the women who may have endometriosis. It is also for their parents, partners, friends, children, colleagues, anyone who cares. So before we go on to understand what endo is, let us quickly have a look at female organs. I'm honestly the world's worst artist, but I have still tried to draw for you. This is the womb or uterus, connected on both sides at the top with the two fallopian tubes, beside which are the ovaries. The ovaries are the organs producing eggs as well as the hormones estrogen and progesterone, and both of these functions happen in the reproductive life. Below is the neck of the womb or the cervix joined with the vagina. The womb has a wall made of muscle and an inner lining made up of a special kind of cell that responds to the hormonal cycles by bleeding, which we also know as having periods, roughly once a month. In endometriosis, cells that are similar to the lining of the womb grow in other areas. These deposits growing in aberrant places keep on responding to the hormonal changes during the periods, causing local inflammation, irritation, and scarring. Deposits happen commonly on the ovary, in the ovary forming cysts, on the lining of the tummy, in front or behind the womb, and can even involve organs like the rectum and the bladder containing urine. There are also reports of endometriosis growing in other areas of the body like the belly button, the skin scar following cesarean section, and even remote organs like eyes and lungs. Thankfully, endo involving areas outside the tummy are extremely rare, and if you have bloodstained tears or cough out blood, please contact an eye or a lung specialist to rule out other conditions first. Endometriosis can also happen within the muscle wall of the womb, and that has a special name, adenomyosis. Now, one of the first questions that women ask when faced with a diagnosis of endometriosis is, why has this happened to them? My honest answer is, we do not know yet. There are a couple of hypotheses on the cause of endometriosis, and I'm not going to bore you with the details. Both theories have their own merits and demerits, and in fact, both of them may have their own roles to play, but we are not exactly certain how. There could also be a genetic element involved, as if your mother or sister has had it, you're more likely to get it. What we do know though is that endometriosis affects 1 in 10 women, and the average time taken for diagnosis is 7.5 years. Can you imagine anything between 3 to 15 years elapsing from the onset of symptoms to the time one is told that yes, you do have endometriosis? But why? Why this unacceptable delay in today's world? Well, there are many reasons really. One of them being because the symptoms of endometriosis can be non-specific, mimicking symptoms that happen with other common conditions of the tummy, like the irritable bowel syndrome or IBS. So most women experience some sort of disturbance and difficulty with the periods, even in the absence of endometriosis. So in a way, the symptoms are normalized. This is especially true for young girls who are often told that their period problems will settle once they become older or have kids. And what symptoms am I talking about? To start with, tummy pain during the periods that may start a few days before the periods begin or may even happen at any other time of the cycle, and in extreme cases can be so severe that normal functions of one's daily life are affected. In addition, there could be pain felt during sex, making intimacy difficult, pain during passing stool or urine, or even diarrhea during periods. Periods themselves can be heavy, irregular, and even prolonged. Again, things that can significantly affect one's lifestyle. Endometriosis can also cause trouble getting pregnant, and one may need fertility treatment. It may cause long-term fatigue and depression. Some women, however, can have no symptoms at all. Surprised? That is indeed true, and it's one of the things about endo that stumps us gynecologists, because the severity of the symptoms can have little or no correlation with the extent of the disease. For example, if I have diabetes, the higher my blood sugars are, greater is my risk of complications. Not so straightforward with endometriosis though. Some women may have massively affected tummy with all organs involved and everything just stuck to each other, but they may never have had any problems. Endometriosis may have just been incidentally diagnosed for them when the tummy is opened up for, say, a cesarean section following a totally spontaneous and uneventful pregnancy. Whereas some women may only have the tiny speck of endo and can be bedbound with pain for at least a week every single month. So how do we diagnose endometriosis? Well, to start with, your doctor will first take a detailed history and may even need to do an internal examination. This is to feel for any lumps or tender areas. You will then be asked to have some tests done. The basic one is, of course, the ultrasound scan, preferably one that is done transvaginally. If endometriosis involving rectum is suspected, you may also be asked to have an MRI scan done. The definitive way to diagnose endometriosis is by laparoscopy or a keyhole operation. In this, a small camera is introduced into the tummy through the belly button. Of course, you will have general anesthetic for that. You may also have 1 or 2 additional small cuts, and then we'll go inside to directly visualize the insides of the tummy and to confirm the presence or the absence of endometriosis, sometimes with the aid of biopsy. Now, you may think that if laparoscopy is the gold standard, why bother with scans? This is because scans may show presence of endometriotic cysts or other features suggestive of advanced disease. And that information is vital to us surgeons when planning and preparing for a surgical procedure. This includes having detailed discussion with you. Any kind of operation, no matter how small, has risks, and before we go in, ideally we should have some idea about what to expect. Is there a cure? The answer is no. At the minute, there is nothing that can totally and permanently take away endometriosis, and I'm being really honest with you. It, however, stays in check once menopause sets in and improves during pregnancy. But fear not, please do not fear. There are several options to control it and help you lead a normal life. It is important to understand that management of endometriosis, however, is not a one-size-fits-all. And we consider all factors before providing you with options that are suitable for you. While endometriosis can be severely debilitating, thankfully, it is not life-threatening, and treatment can be tailored to a patient's condition, her fertility choices, and her own wishes. This can also mean choosing to not have any treatment at all. Among the treatment options, I will start with the medicines like painkillers, simple over-the-counter ones, paracetamol, ibuprofen, and medicines that help to control or reduce the bleeding. These do not contain hormones and can be all that some women need, but often they are not enough. We will then try medicines that contain hormones that, to put it simply, keep the ovaries asleep. If you remember, at the beginning I mentioned that endometriosis affects women of reproductive age and that the deposits respond to the hormones that are produced by the ovaries. So essentially, if we can manage to keep the ovaries asleep, the deposits will not get their fuel. So ovary sleeping, no hormone, deposits quiescent. Hormonal medicines can either contain both estrogen and progesterone or only progesterone, like the combined pill or the mini pill. Progesterone can also be introduced in the body through a special type of T-shaped coil that is kept in the womb, or through injections or implants. Please note that all of these also are contraceptives, which mean that you will not be able to get pregnant whilst on them. But they are also temporary contraception, which means fertility should return when you stop using them. I must also mention here that if your doctor has prescribed you any of these, that does not mean that they are judging your sexual life. As I know that in some cultures there is a taboo against the use of these sorts of medications, especially for the unmarried. Apart from these, there are other non-contraceptive hormonal medications like some that puts your body in a false menopause state, in a temporary menopause state, some medications that mimic the action of testosterone. Whatever formulation and delivery system is used, the basic intention of all of them is to stop ovaries from making hormones, and once again, they are not suitable for you if you are trying to get pregnant. They can also have some side effects that may be unacceptable to some. I'm sure you will discuss this with your doctor before starting them. In addition, plenty of patient information literature is available on the internet. Unfortunately, like everything else, even in medicine, there are lots of non-medical evidence-based information on the web. So please ask your doctor for recommended websites. I will include links to some of the sources that I trust in the video description below. Now, sometimes medicines are not enough and surgical intervention may be required. Commonly, that involves a keyhole operation like the one I described. Keyholes obviously have better recovery rate, but sometimes the disease may be so widespread that tummy may need to be cut open with a bigger incision. If endometriosis involving the rectum or bladder are suspected, other specialists like bowel or bladder surgeons may also be involved in the surgery. Now, operations mainly involve removing the deposits, the cysts, using specialized instruments to destroy the deposits, and in extreme cases, remove affected organs like ovaries, womb, or part of the rectum. But please do not be scared. Before the surgery, we discuss with you all the pros and cons and take full cognizance of the wishes of our patients. Success of surgery varies, and for some, unfortunately, this may not still be enough. Thankfully, nowadays we have another medical specialty join hands with us, gynecologists, in our relentless fight with endo. They are the anesthetists, the clever doctors who can put you to the deepest sleep of your life, numb massive areas of your body, and can also help you deal with pain. You may need to take pain modifiers, which are medicines that can alter the way your body responds to pain. Sometimes pain specialists can also recommend you take injections that numb certain nerves that are thought to trigger the pain sensation in endometriosis. Physiotherapy to strengthen pelvic muscles can also be suggested. In addition to all the medical and surgical interventions I explained, lifestyle modification like exercise and going in for plant-based diet are also said to be of help and can easily be tried. In my opinion, they should be tried even if you are also having conventional treatment at the same time. Complementary therapies like acupuncture, TENS machine, herbal supplements, homeopathy supposedly benefit a few. There is, honestly speaking, limited evidence for their effectiveness, but is worth a try. It is important that you understand the possible side effects before trying them and make sure you do not have any condition that can be aggravated by the use. Last, but certainly not the least, all the physical discomfort can lead to mental health concerns. And you know what? Sometimes you may just need professional help, and it is okay to seek help. Behavioral therapy does not mean your doctor is doubting your diagnosis. We understand how isolating and devastating endometriosis can be, and we do wish we had a magic potion. Even as I speak, doctors and biologists around the world are working on valuable research that hopefully will help us to understand and manage this better. And who knows, by the next endometriosis month, I may have good news to share. In the meantime, take care of yourself. If you have any question, you can leave it in my comment box. I promise to anonymize my answers. If you want to communicate privately with me, my Instagram handle is right here. And if you wish to hear more from me, please subscribe. Thank you. Bye.